Now the monogenic disease gene, 2,000 of them has been already known. Okay, 2,000 monogenic genes, very rare diseases. Okay, and but these does not help our clinic so much. But how about the multifactorial diseases? So as for the multifactorial diseases, this is a cause of diseases, and for the monogenic rare diseases, the genetic factor accounts almost 100%, or maybe some of the environmental factors here. And on the other hand, there's diseases that the genetic factors are not affect, like injuries and infectious disease. The communicable diseases might be around here, which a little bit of genetic factors might be involved. We have a graduate student from Myanmar who came to my department. He studied about tuberculosis, and he found that some of the genes or SNPs are associated with risk for getting tuberculosis. But today, I'm going to talk about something which genetic factors plays more role in the whole cause of the diseases. These are multifactorial common diseases, including diabetes, hypertension, cancer, and so on. But still, we do not know whether the genetic factor accounts for 70%, 30%, or the environmental factor causes 70% versus 30%. That is still an ongoing research, but we are making some progress towards that. Well, the topics today is about metabolic syndrome here, and it is a cause of the atherosclerosis. Here you can see that there are deadly quartet, namely high blood pressure, high blood glucose, obesity, and hyperlipidemia, which are very acquired symptoms. And this raises to the atherosclerosis, which also is called the silent killer. But this has almost no symptoms until all of a sudden there is a severe complication or event called myocardial cerebral infarctions. So we have a lot of time to prevent these things while it is very silent. And what we want to do is to ask is, can human genome information be used for better prevention? So again, here, the metabolic syndrome, this is a typical multifactorial disease, and it consists of environmental factors as well as genetic factors. And as for the environmental factors, there's excessive nutrition intake, lack of exercise, sedentary lifestyle, drinking, smoking, stress, and maybe the next speaker will talk about endocrine disruptant kind of things. And also there's genetic factors that affect central obesity, chronic inflammation, and insulin resistance. So these are all physical causes that lead to abdominal obesity, diabetes, hyperlipidemia, and hypertension. These are the metabolic phenotypes. And the pathophysiology underlying this is insulin resistance and low-grade chronic inflammation. The previous speaker talked about epigenetics as a cause of gestational diabetes or maybe other diabetes, and that is recently a very big novel issue called DOHAD. This is Developmental Origin of Health and Diseases, which means that a baby in the uterus is very susceptible to epigenetic changes, so that change may lead to susceptibility to diabetes, metabolic syndrome, and things like that. So that is another hypothesis now being tested. But today I will not go into this, but rather to the genetic causes.
CFAM, caring for well-being.